Hello friends, today we will discuss about different routes of administration of homeopathic drugs. How homeopathic drugs was administered in different path, how its administration. So first we discuss 5 routes. What are they? One is oral route, then sublingual route, then parenteral route, then nasal route, then external application. So nasal route, rectal route, these are belongs to tropical route. So what is it and what are the example and what are the advantages and disadvantages of these routes we discuss in this video. So first we discuss oral route, which is mainly general way of administration of homeopathic drugs. Mainly oral route is the route which is the most safest and most convenient, मीन्स मोस्ट सेफेस्ट मीन्स क्योंकि इसके अंदर इस रूट में हमको और कुछ मेडिसिन का स्टैंडर्डाइजेशन प्योरिटी सेफ्टी को देखना नहीं चाहिए तो इस मतलब से वो ओरल रूट मोस्ट सेफ्टी होता है क्योंकि हम दिस इज मोस्ट सेफ्टी ड्यू टू वी टेक इट बाय आवर mouth, and so that it is more safety because there will be no hemorrhage or any type of infection cannot appear in the mouth because there are many foreign defensive organism, defensive self antibodies and self antibodies are present in the mouth, and many chemicals such as lysogen they can fight with the different types of foreign pathogen and can engulf it, so that this route is more safest because there are so much sophisticated things are not applicable on this route, so it is most safest, most convenient, means all type of people, means all type of susceptibility of the people can afford this route because the children as well as the old people can give by this route. All type of people can afford for this route because this route is most commonly available in any type or any person, any different age groups, and economically affordable, means economically affordable it is says comparatively with the our subcutaneous venous injection type. So because venous injection it is likely very expensive, whereas the tablets or any type of medicine which we take in the routes are most easily affordable, means because it having easiest cheapest price, so that way we call it as the most affordable. Then which type of medicine we use in the oral route? Mainly tablet, syrups, globules means the small solid vehicle of in homeopathy there will be used at the globules, the white matter, white color, these are the globules. Now and the powders also we use by grinding these globules, then we can create the powder which are also taken in the mouth, so it is called also in the this medicine can undergo in the oral route. Then mother tincture or mother solution or any type of potency we also use by oral route. What are the things which we use? That is syrup. These are used mainly in the liquid preparation in mouth or oral. We use mainly liquid preparation. Why? Because it can absorb in the intestine easily than the solid, so that it acts in our body very fast, due to which we use liquid preparation of the medicine. Then we should take the medicine in empty stomach. Why? Every student or every patient who are going to the physician in the homeopathy especially called as you take medicine so much very much often it is said by the physician that we take the medicine in empty stomach. Why all medicine are taken in the empty stomach? Because those medicine which are given into the patient, if it is taken by the stomach full, means after meal, then what happened, the medicinal power and the meal, means those food which he take or she take will be mixed up, so that medicine power does not act so much properly. that for which we take the medicine in empty stomach. Then there will be also exception is present, means those medicine mainly which are GIT irritation, means those medicine which causes our gastrointestinal acid reflux, that type of medicine are given after meal. So one important thing in the oral route we should remember that the taste should be is the important factor of oral administration. Why? Because of the taste there are many type of vehicles used for that taste, means those different edible different ages of patient or ages of a group of patient when take that medicine in the oral route, if the taste is not so edible like manner, then we use tonic or any type of a cough syrup. They are mainly their taste are so much bitter and rough, so that we use main in the homeopathy there will be caramel type of a sweetening agent only we can use. No other sweetening agent are applicable in homeopathy rather than caramel. So that is the point we should remember. In merits we should remember that in the oral route is the way which is safer, convenient and painless, means here any type of injection was not given in oral, so it is so much painless. So it and any type of a requirement of a sterilization does not require, such as in cutaneous type of injection we use sterilization, but here no sterilization is required. So that these are the merit point of the oral route given. Whereas limitation, what that limitation means drawback. What is its drawback? Means it acts slowly, its action is so much slow, so that and also we can't afford oral route in every patient, because those patients which having vomiting, unconscious or any type of mad person who are not cooperative to give oral route, then we can't give oral route. These are the limiting point. What are the limiting point? We find that one, we can't give oral route in the vomiting or unconscious person, it is so much slowly act, so in acute or emergency case we can't give oral route. And the third, those person who are mentally ill we can't afford because they are non-cooperative towards the medicine. After oral route we have the sublingual route. So sublingual route is the route where the medicine was given placing under the tongue. Lingual means tongue, and the sub means under. So its name itself says that where its roots, so that its medicine can absorb. Why we give under the tongue? Because under the tongue there are enough nerve endings are present, and those medicine can rapidly absorb through that general circulation or nerve ending, and can act very much easily and so fast, due to which we use sublingual route. So what are the advantages of this route? So where in this route the medicine is bypassed through the lingual and direct absorb in the circulation. So when we take in the oral route we use lingual route, but in the sublingual we do not use lingual. Lingual means the tongue, so that its medicine does not affect by the tongue and can absorb so quickly through the circulation. So but here one disadvantage is that only lipid soluble drug and a non-irritating type of a drug can use, and not we can't use water, makeup water made medicine. So that these things are not applicable on this disadvantage point of the sublingual route. After sublingual, our third point is our parental route. Route means in parental, its name itself says other than intestine, means those route which are applicable in any type of roots in any type of our bodies, but does not enter into our intestine. Means mainly commonly this type of route is used in the most clinical case. We use this medicine by the made of injection. Injection is commonly under this parental route. So what happened in the injection, we can't give injection in the homeopathy. It is strictly prohibited in the homeopathy. Why? Because injection is made homeopathy medicine are made of alcohol. Much alcohol are present in the homeopathy medicine. So when this alcohol are administration through the injection, then it causes so much damage and causes so much vulgarity behavior on the person. So we do not take homeopathy medicine as injection. One route of parental, that is intradermal. We can give injection in the intradermal. Derm means skin, under the skin, or muscular, under the muscle. On the subcutaneous means on the skin, or intravenous. Or intravenous means those are used only when the drugs are poorly absorbed in the stomach. Means any person having stomach is ill or stomach does not work properly, we use intravenous injection or intravenous route. So what is its important? It acts so much rapidly, so that we use intravenous injection. So intravenous, what happens? It acts only when the those drugs which are poorly absorbed in the stomach, we use through intravenous injection. So those medicine which are rapidly having effect, these are comes under this intravenous type of routes. So what are the demerit of this type? That is, the proper sterilization should be done to make, so that if not, then there will be the death can be possible. What are the example of this type? Anaphylactic shock. So you know, any type of injection when it is not cutaneously verified or cutaneously not tested, then what happened? The person suddenly get so much allergy and having a type of a condition which is known as anaphylactic shock, or any type of a sepsis like of condition can occur. Then now we go towards the tropical route. Fourth type of that is tropical. So tropical, its name says that the topics means those tropical way where in tropical route there are mainly we discuss nasal route and rectal route. So what is nasal route? Nasal route is the route where the drug substance are used by inhalation. So why we use the drug in the inhalation process? Because these are volatile in nature. Means those drugs when taken, they can evaporate or they can swap out. So that we use the inhalation process for that for that drug substance. Mainly what are the advantages of this drug substance? That we use mainly aerosol. Aerosol is what? It is a inhaler or nebulizer. What it causes? It causes bronchodilation, so that it can act so much properly in the definite area where the nose congestion was appear. That is the advantage. Whereas this and also we use amylum nitrosum, which is used for the control of epilepsy. When the person is epilepsy, it is unconscious, so in that way we can use nitrosum by inhalation. So that is the disadvantage, that when there will be any drug which we use ether containing drugs can cause irritation to this respiratory tract. That is the disadvantage of that nasal route, that we do not use ether. We do not use ether because it causes irritation to the respiratory tract. Inhalation power. So inhalation by inhalation, it is quickly act on that nasal route and on that nasal area where the congestion occur. So that is the very good way where the nasal route having very good advantages on that by aerosol or any type of amylum nitrosum, which is the best remedy for the epilepsy. Was the rectal route. Rectal means rectum. Rectum means the last part of our anus, gastrointestinal canal, where fecal matter are deposited. After rectal, the anus through which fecal matter are opens out during defecation period. Defecation means those time where we dispose our fecal matter. So rectal root, where it is present, what is the happened, that when any surgical operation was done, then what happened, the drug should be when any surgical operation was done to be, then what happened, we should administrate the rectal administration of the medicine was done, because to evacuate bowel means the fecal matter we should evacuate, so that we can done the surgical operation on that way, on that position, or any type of anal or any type of surgery in that pelvic position, we should first evacuate the bowel. That is the main importance of a rectal root. How, but sometimes we also use olive oil, because to any type of, when any type of local irritation was appear in the on the rectal side, then we use olive oil for reducing that rectal irritation. In case of children, we use also glycerin for the rectal use. We also use glycerin, but it is they having the disadvantage. Rectal root you can use in the unconscious person also, because it does not require any type of consciousness, and it is so much important in the bowel evacuation. That is the important point you should remember. What is the advantages? It can administer when the person is in the unconscious, or if we give a drug which is type of irritant nature, we can also give through this rectal route, and any type of unpleasant drug also give through rectal route. Give through rectal route, through this route. So that is the advantages, whereas its disadvantages is that it is act slowly. So slow acting, inconvenient means it is not applicable in all type of medicine, so inconvenient and embarrassing nature. That's why the rectal route is not so much popular. Then external application. External application is also last category, where we use the medicine in a two way, by dermal or by mucosal. Dermal means on the skin, so mucosal means under the skin, the lining of the any type of a visceral organ. Mucous lining is known as a mucosal application. So in mucosal we use lotion and a glycerin as a medicine for the mucosal application, but for the external application such as dermal, we use the medicine which having the vehicle can pass the epidermis easily and can carry the medicine or carry the drug up to the affected side. So we use the cutaneous application of the medicine but these application are medicine are slow acting, and a prolonged observation was required for that to heal. After prolonged observation, it can heal. So this type of medicine are used mainly antiseptic, antipyretic medicine type of medicine are used by this route, dermal route or cutaneous route. But it has the disadvantage. What is the disadvantage? That it sometimes when these drugs are used in the skin, it can cause irritation, allergy can occur. That is its disadvantage. So what we study routes of administration by 5 types, such as oral route, parental route, nasal route or tropical route, then cutaneous, then our external application, and their disadvantages and advantages and its function. So in this way we complete the total routes of administration of a drug.